Welcome to our early chronic kidney disease education session. This is Dr. Kadri, and I will be your narrator. The kidneys are a vital organ. In other words, we cannot survive without enough kidney function. Most people have 2 kidneys, and they are shaped like kidney beans and are roughly the size of a closed fist. Each kidney contains millions of filtering units that filter your blood to remove excess waste and fluid that accumulates in our bodies. The kidneys are located approximately halfway between the base of your neck and the bottom of your tailbone. They receive blood supply through the renal artery, which is a branch of the main artery in your body called the aorta. The kidneys are located towards the back of your body and are protected by your lower rib cage. The kidneys are truly a fascinating organ. They contain millions of filtering units called nephrons. Each nephron is made up of a glomerulus or blood filter, which is attached to a tubule, which is responsible for chemical and water balance that eventually produces urine. Most kidney disease affects the nephrons, which are the tiny filtering units inside the kidneys that clean your blood and produce urine. This slide shows a diagram of the kidney, and on the left you can see that blood flows into the kidney through a renal artery. That blood is delivered to each individual filtering unit called a nephron, and there are millions of these filtering units in your kidneys. Blood is filtered and eventually urine is produced by altering the composition of wastes and water that eventually leave your body to form urine. Urine is deposited into the ureter and subsequently travels down into the bladder and then eventually out of your body. Filtered blood leaves the kidney through the renal vein and then travels back to your heart. This is how the kidneys keep your blood clean and control your fluid balance. So to summarize, the kidneys control the chemistry in your blood. They also eliminate electrolytes and waste products that occur through regular metabolism in your body. They are very central in controlling your fluid balance. They also play a very important role in controlling your blood pressure and preventing anemia and ensuring that your bone marrow makes an appropriate amount of blood. Chronic kidney disease is a condition where there is evidence of presence of kidney damage or reduced kidney function for a period of at least 3 months or more. This is generally detected on blood testing. In the vast majority of cases, patients have no symptoms from their chronic kidney disease, and it is detected incidentally on lab work when they visit their healthcare practitioner. Chronic kidney disease can be divided into 5 stages, and this depends on the severity of damage or decrease in kidney function. It is important to note that not everybody progresses from stage 1 through to stage 5. There is generally no cure for chronic kidney disease. In most cases, the goal of treatment is to keep the kidneys functioning as well as possible for as long as possible. This slide illustrates the various stages of chronic kidney disease. Stage 1 being the mildest and stage 5 being the most severe. As mentioned earlier, a majority of patients never progress to stage 4 or 5 chronic kidney disease. Most often in stage 1, 2, and 3 of chronic kidney disease, patients are asymptomatic. Chronic kidney disease in these instances is generally only detected on screening lab work or urinalysis or ultrasound imaging. If patients progress to stage 4 or 5, they are more likely to develop symptoms of advanced chronic kidney disease. Early on, it is very important to make sure blood pressure is well controlled, and if you have diabetes, that is well controlled as well. It is important to remember that kidney function naturally declines with age. However, if you have certain risk factors, your kidney function may decline more rapidly than based on age alone. These risk factors include diabetes and high blood pressure. These two conditions are by far and away the most common causes of progressive kidney damage. Diabetes and high blood pressure can damage the blood vessels in your filtering units, leading to progressive scarring. If you have inflammation of the blood vessels in your filtering units, this is called glomerulonephritis, and this can reduce your kidney function as well. Polycystic kidney disease is a hereditary form of kidney disease that can lead to progressive kidney dysfunction. Other causes of progressive kidney dysfunction include chronic infection of the kidneys, chronic urinary tract obstruction, and at times certain medications can slowly decline the function of your kidneys. As mentioned earlier, your kidneys filter blood and make urine, and this urine is subsequently deposited into the ureter, and it travels down into the bladder and then out of your body through your urethra. A kidney stone can block one of your ureters, and this can be quite painful as it blocks the flow of urine. In older men, an enlarged prostate can block the flow of urine out of the bladder and can cause progressive kidney dysfunction if the blockage of the flow of urine is persistent over time. Diabetes and high blood pressure are by far and away the most common conditions that reduce kidney function over time. This is mainly by scarring the filtering units of the kidneys. This can lead to permanent kidney damage and protein leakage in the urine. Good control of diabetes and high blood pressure can preserve your kidney function over time. In addition to that, if you are a smoker, smoking cessation can definitely help as well. Controlling your cholesterol is also very important to your kidney health. Regular exercise and weight loss as needed can also help control your diabetes as well as your hypertension. Limiting alcohol consumption has also been shown to be beneficial for blood pressure control, which in turn can help kidney function last longer. This is why in treating patients with chronic kidney disease, we often stress good control of your blood sugars and your blood pressure, as well as regular home monitoring of both of these parameters. This is a slide to show a healthy glomerulus on the left with normal blood vessels that are responsible for helping to filter your blood and make urine. On the right is a glomerulus that has been affected by diabetes and high blood pressure with scarring of the blood vessels that subsequently impairs kidney function. Avoiding dehydration is also extremely important to avoid fluctuations in your kidney function. Sudden dehydration can worsen your kidney function. Always try and maintain adequate water intake to avoid dehydration. To summarize, keeping your blood pressure and blood sugar under good control is extremely important for the long-term health of your kidney function. Avoiding dehydration by adequate water intake is also suggested. In addition to that, certain medications can worsen your kidney function as well. Anti-inflammatories such as ibuprofen or Motrin should be avoided. However, Tylenol or Tylenol Extra Strength is quite safe. The excess use of diuretics can worsen your kidney function. You should always make sure that you are on the appropriate dose of any water pills to make sure that your kidney function is optimized. Certain antibiotics would need to be used with caution if you have chronic kidney disease. Always check with your healthcare practitioner before taking any medications to ensure that they are healthy for your kidneys. This program has been supported by the Care for Kidneys Foundation.